Well, hello, my name is Lee Williams, and welcome to the second of our four-part series for parents of college-bound autistic students. I'm the director of the College Autism Network, which is a professional association and research hub for college campus-based practitioners who support autistic students, employers who support autistic graduates, and researchers who study autism in higher education. Uh, and the impetus for this series came about from a lot of the conversations and meetings that we have as a network, uh, where we talk about some of the particular challenges of our work. And what I kept hearing from our program leaders on campus is that there's nothing better than a really well-informed parent when it comes to making sure that a student is getting into the right kind of program or setting or campus where they're going to really be able to thrive. Um, Within CAN, we talk about autism-specific programs, and there's about 150 of those that are on different campuses throughout the country. But obviously, with 4,000 higher education institutions, most don't have a formal program, but instead provide services and supports through their disability services office, their access office, their student support services. My colleagues here are, however, directors of programs that are on campuses. And so in that role, they have really carved out an expertise in working with autistic students. So what we're going to do, actually, let me start by asking my co-host here, Matt, to introduce himself and tell you a little bit about his journey.
Sure, thanks, Lee. I am a parent. I don't know if I'm a informed parent, as you indicated earlier, but my name is Matt Gunner, and my son Peter is currently a rising sophomore at the University of Arkansas, and he attends Arkansas with the help of the ASP program there under Dr. Eliza Green, and he had a great first year. I'm happy to report. Made some friends, did very well academically, went to a lot of football and basketball and baseball games. He was very happy after his first year and headed back in the fall. And our family really learned a lot through Peter's search process as well as his first year. And I wanted to kind of pay it forward a bit and started a YouTube channel called Inclusive Academia. And on that program, we share a little of what we learned with other families like ours. I have been fortunate to have a chance to chat with every one of the amazing panelists that we have here tonight. They've come on to Inclusive Academia and they have discussed their ASP programs. And I am really excited to hear what they have to say on this critical topic because these ladies are very, very knowledgeable. So thank you for having me tonight, Lee.
Great. Thanks, Matt. Yeah, Inclusive Academia is an amazing resource for families that are exploring college programs, autism-specific support programs, ASPs, and want to meet some of the leaders of those programs without having to travel across the country. I think what's really obvious when Matt and I talked about what the topics would be for this series, mental health was one that was kind of a no-brainer. It is such an important topic. It is definitely on the minds of a lot of families and students and the professionals who help them. And so that's why we just rounded up some folks that I know are really knowledgeable and skilled. And I'm going to ask our panelists to introduce themselves. And then we'll start off with a few questions that Matt and I have for them. At any point, if you have a question or follow up to something that one of them has said, you can put it in the Q&A and I'll see that and facilitate that answer. And as we get towards the end of this hour together, plenty of opportunity for you to ask questions. We just ask that you not provide any identifying information about your student because this is a recorded webinar and we want to respect their privacy. So with that, I'm going to start with Ashley. If you're willing, you're on the upper left of my screen.
Hello, my name is Ashley Richardson Minute, and I'm the director of Longhorn Ties Neurodivergent Support. I am freezing. I said my weather was okay down here, so I apologize if I'm freezing. I'm the director of Longhorn Ties Neurodivergent Support at UT Austin. Our program has been around for 5 years, so we support neurodivergent students, students with autism, ADHD, things of that nature throughout their tenure at the university. We have 5 domains that we focus on, like many of the programs across the state: academic planning and success, social connection, independent living, health and wellness, and professional development. I'm a licensed clinical social worker, board approved supervisor, and mental health is always, a topic among our team. Over the past few years, we have seen our students' needs increase, and we as a team have continued to try and figure out how to support our neurodivergent students with their mental health needs. So that's what drew me to this presentation, and I'm happy to be here.
Thanks, Ashley. Sharon? I should say that several of our panelists are in parts of the country where the weather could take them out in at a moment's notice. So if anybody disappears, you'll just know that they're probably running for shelter. Sharon?
Hi, I'm Sharon Thompson. I'm the coordinator of the College Success Program at Eastern University. Eastern is a small private liberal arts college outside of Philadelphia, and our program is an autism-specific program at this time. I'm also a parent of an adult on the spectrum and who is grown and flown and graduated from college and employed and recently got promoted to the head of their department. So I'm quite proud. I'm also a licensed psychologist, and I provide some mental health services through our Center for Counseling and Psychological Services, which is the department under which the CSP operates. Our program has been serving students for 13 years, and I've been the coordinator for 11 of those years. We provide comprehensive academic, social, and residence life support, including early move-in, pre-fall semester orientation, individual and group meetings focused on academic, social, and career development, social programming, peer mentoring, supervised study hours, academic coaching, graduate student mentors who live in the residence hall to provide support with residence life, as well as after hours support and liaison support with campus offices, faculty, and staff.
Wow. Thank you, Sharon. Good to hear all that. Amy?
Hello, everybody. I'm Amy Rutherford. I am currently the co-director of College Autism Spectrum. College Autism Spectrum has been around since the early 2000s, where our founder, Jane Theophil Brown, started Marshall was right there alongside maybe first, one of the first college support programs in the country, and since has been doing a lot of work helping colleges kind of build programs, learn what works, what doesn't work. And through that, Jane helped us start the Mosaic program at the University of Tennessee at Chattanooga. So for 16, 17 years, I co-founded, co-directed, and led the program there. But as of January, I left support programs and now I'm serving in a full-time capacity with College Autism Spectrum. So throughout my responses, you'll probably hear me reference a lot of my experience as a program lead, but also as someone who talks directly with parents, because College Autism Spectrum is about helping families identify kind of what to do in preparation for college, transition into college, and then that transition out. And so we also offer some coaching pieces that are very similar to what Mosaic offers, which I think is important to point out. They focus in on academic, social, and career prep for students. And so you'll hear me kind of interchange my responses as like a community representative, but also someone that spent many years building and running a support program housed at a university. I'm also a licensed professional counselor, board approved supervisor as well, Ashley. Mental health is super important to me. We get a lot of calls from families who are just kind of interested in kind of exploring what that transition looks like, how to prepare, how to transition therapists. And it's just one of those things that's heavy on my heart to continue to provide families with resources.
Great. Thank you, Amy. Mindy?
Hi, I'm Mindy Thornton, and I'm the director of the college program for students with autism spectrum disorder that is part of the West Virginia Autism Training Center at Marshall University. And as Amy already told everyone, Marshall was the first program that started in 2002. And we started out supporting one student, and now we have the capacity to serve 72. And like our other panelists, we provide support to students by helping them with executive functioning skills, social skills, and independent living skills, all with the goal of helping them get through college and find the career and get a career in the field of their choice. We work really closely with professors to find the most effective ways to accommodate the needs in the classroom. And then we provide all of our training and skill development in individual and group settings. We also have a mental health counselor as part of our staff and team member. So that's really nice that the students in the program do have that available for them. But you know, it's a really fun time. I come from the mental health field as well. I'm a psychologist. So this is very near and dear to my heart as well.
Thanks, Mindy. Thank you all. So I hope our audience feels like they're in good hands with this group. I'll start off with a pretty broad question. What are some common mental health challenges that autistic college students face? And how might these differ from their neurotypical peers? Who'd like to start us off?
I'll start. I think transitions are times when anybody, regardless of neurotype, is more likely to experience the onset, exacerbation, or recurrence of a mental health condition. And college can be one of those transitions that causes that. Students of every neurotype often experience homesickness, loneliness, academic stress, difficulties related to having to manage their activities of daily living more independently. So those things happen for all students. Since transitions can be more challenging for autistic individuals, they may be more likely to experience exacerbations or recurrence or onset of co-occurring diagnoses. And some of those challenges may feel more daunting to our students on the spectrum.
Great, thanks, Sharon. Ashley?
Yeah, just to add to that, so we know anxiety, depression is really prevalent among a lot of our college individuals, but we see a lot of autistic burnout from students having to mask in different environments and live up to the expectations of navigating in their neurotypical world. And that often leads to depression and isolation. And so those are things that I would say kind of a lot of our students deal with as well.
Amy, you had something to say?
Yeah, I was just going to add to that. You know, if
Yeah.
you think about like the transition in, which was one of the first things that Sharon, you mentioned, and Ashley, you touched on it, the executive functioning shifts, right? Newfound responsibility, lots of demands. And maybe for some of the students who are transitioning in, it's that newfound awareness of potential impacts. And how do we regulate? How do we navigate? And that can have a mental health impact if that awareness piece, if you've always been structured and you always had something go this way or could work through things, and then those newfound demands of executive functioning can have that result in potential burnout, like Ashley was saying. So just thinking about the transition in general, I think is important to kind of highlight where and why mental health challenges might occur.
Great, great. So really rich content there. Transition issues, the anxiety and depression co-occurrence, and yeah, the responsibilities change a lot, and executive function skills need to keep up with that. Mindy, did you have?
Yeah, I was just going to add that this is a lot of times the first time that these students have had the opportunity to take care of their mental health on their own, and sometimes that doesn't go as planned. and they do need some extra support. I feel like that is important. We've had students in the past that have been like, oh, I don't need to do that every week and go see my therapist. I can just go in once a month, and sometimes they need to have that consistency and be able to stay on that schedule.
Yeah, great point. Great point. Matt, do you have a question?
Yeah, thanks for your responses on that first one. Very insightful. I think we are lucky that I think our country is beginning to wake up to the importance of this issue, and we're seeing a lot of universities invest more and more resources into mental health for their students. But certainly there are still gaps out there. And could you talk about some of the biggest gaps that you recognize specific to the neurodivergent students that you work with on a daily basis on your campuses or elsewhere?
Ashley?
I'll take it off and jump on what Amy and Sharon had mentioned, the executive functioning of accessing supports, the dealing with, possible scheduling, the communicating back and forth, the finances and insurance, and just all of those things that has been like really challenging for students we work with, as well as a lot of counseling centers are at capacity and don't provide long-term support. They provide that short-term support. And a lot of providers are still not as comfortable in providing therapeutic support to autistic individuals. And so we have a lot of counselors within our counseling center that are continuing to seek out training because they want to be more aware. But that is a barrier, and that is a challenge.
Sharon?
Yeah, I would second all of that. But that is a gap that doesn't just exist on college campuses, it exists in the community as well. We do have a shortage of therapists who are trained and experienced in working with neurodivergent populations. Although I did recently find at least 5 different organizations that have databases of neurodivergent therapists who are either neurodivergent themselves or have been kind of screened to be neurodivergent affirming. So there's awareness of that gap, and people are working to try to fill it.
Mm-hmm. Great.
I'm going to add that a lot of the colleges are going to a virtual kind of support counseling services, and sometimes that's not always what a student will flock to. And so I think just again, it's a lack of trained individuals, and then sometimes virtual just I don't think is the best for students on campus.
And a follow-up, if I could, on that, Mindy. What do you all see as the typical model when you have new students arrive on campus? If they have a therapist at home, do you often see they try to continue that relationship, or are there things that families should think through in that regards in terms of the relationship that they're bringing with them from home potentially?
I mean, that's one of the first. I'm sorry, I jumped in before you called
It's
my
okay. I think we're going the same route.
I got excited. Go ahead, Mindy.
No, I was going to say, honestly, I have this discussion all the time, and it really depends on the student. And a lot of times parents know their student best. And so some will say, no, I need to see somebody face to face here on campus. And it's good to know that early because we can get that set up. But if they have a very good relationship with their therapist and that's working well, then by all means, that should continue.
Yeah, I was going to support what Mindy said there. I think that we also have to remember that there's some limitations. Some of the students come from out of state. Families come to us, and their counselors can't see them across state lines. And so that kind of has a layer of complexity there. But anytime I'm working with a family and that's an option, I always recommend at least through that first semester or first year till you can transition in, or in some of those bye weeks. So Ashley, I think you mentioned session limits. A lot of campuses are doing like bi-weekly sessions are kind of as frequent as you can get in. And that's if you schedule from the beginning of the semester. Sometimes students are having to wait because of the capacity that the counseling centers have, they're having to wait like a full month for a session, and that too is lucky. And so if they can see their person that they're familiar with or someone in the community to kind of balance out that more routine of weekly sessions, I think that that is something that I always recommend to families when that gap could potentially exist.
I think it's really critical too that families and students are thoughtful consumers of the services that a college or university is is offering. I I don't want to disparage my colleagues in the admissions world, but when they are promoting their institution, when they're marketing their institution, when they're trying to recruit students to apply to and then attend their institution, those are not necessarily the people who have a depth of understanding of the kind of clinical and emotional support that might or might not be available. And so when a family hears, oh, counseling and it's all free, they might think, well, that's great because counseling is costing us a fortune. And then the student enrolls and they get there and they find out that they're limited to 8 sessions in the course of a semester, and that's not going to cut it. Or that the model that the school has adapted is telehealth, telecounseling, and that might not be best. So it's really about being an informed consumer as decisions are being made about where to go to school.
Can
I want, yeah, go ahead,
that
Amy.
also relates to med management services because psychiatric care too, right? So a student comes with stimulant medication potentially or whatever medication they're taking with a 30-day supply. Well, they don't let folks know until that supply is out. And then you're sometimes waiting 60 days to get in. And when you have a semester that's only 16 weeks, I mean, you're kind of in the depth of the semester at that point. So I think it's important to not only talk about therapeutic services when it comes to counseling, but also that med management piece, being informed about what campuses offer when it comes to that.
And when you're talking
And
about
I think
psychiatry,
continuing
that's,
in that vein, oh, sorry, Mindy, go ahead.
I was going to say, when Amy gets into talking about psychiatry and medical providers, sometimes that takes longer to get into than a therapist. So that's something that has to be planned for in advance. I always tell families sooner the better.
Amy, Ashley?
And I just want to plug as well, because we have a lot of out-of-state students. So that has been the #1 question of orientation this summer, checking with your insurance and your providers, especially if they're out of state and you're trying to get those stimulants. So on that.
Yeah, can we talk a little bit more about medication and some of the challenges that are presented by a student who might depend on or be used to taking medication when they are dropped off for their first year of college?
I mean, I think some of the conversation has already highlighted some of the impacts that might exist. So being informed about what the medication they're taking actually does for them and the side effects as if they don't take it. So there's some medications that have shelf life in our system. So if you miss 1 or 2 days, you're okay. But when you miss more than that, then it takes kind of that sometimes weeks to get back into at a therapeutic level. So when you run out and you're waiting, that has impact on how you feel. That's really kind of outside of your control, just because your body's adjusting back to that medication. And so we can focus on stimulants, we can focus on we can focus on all the different types, but it's all the same. From my perspective, is making sure that routine is established, consistency, and solid communication on kind of what the refill process looks like and what that pill actually does for you. I don't know if anybody else has anything to add.
Yeah, I would agree with all of that. I think students should have a written list of all of their medications and what they do for the student and what the effects of missing that medication will be, so that the students can know what's going on with them. We do encourage parents to pull back a lot, but getting meds refilled is not an area that I encourage parents to pull back on. It is incredibly complex, especially if they're controlled substances. and with insurance and doctor's offices. And so that is an area where I tell families, to please keep helping your student make sure that they get their meds refilled on time, because that's just really challenging. And then we don't have a service of helping students remember their meds regularly. We can do it short term, but there are apps that do that. There are pill boxes that can even notify a third party if the correct compartment isn't opened at the right time. So if the student is going to need extra support, there's technology that can help with that.
Thank you all. And I'll just remind our audience, if you have any questions that you would like to ask, you can drop those in the Q&A on your screen. I'd like to shift a little bit here and just ask, what strategies have proven effective in supporting autistic students' mental health during this high stress transition to college life? What's worked for you? What do you see as really promising methods and approaches? I didn't mean to stump you, but
I
who would like
think
to?
I think we've started to hit on it. We've talked about routine, staying in the same routine. And I know that's hard when they get to college and, they only have one class on Tuesday and Thursday where they're used to being in school from 7 to 3. So that's something is to try the summer before college to keep them on a consistent routine and have them practice that themselves, because that's going to help lots of things. Mental health is one of them. And then also, if the college that you're looking at in the support program has a summer transition program, do it.
Say a little bit more about that, Mindy.
So I know a lot of the support programs, ours included, have a transition where they come in during the summer before their incoming freshman year. So they usually take one college class, live in dorms, and are with the support program for quite a bit of the day. So they get to come into campus when it's not crowded, it's not crazy, you don't have all the dorms full, and it's just a slow transition where they can ease into it. And that does seem to help a lot of students. I see a difference in the students who do that program versus the ones that just come in for the week of freshman orientation, week of welcome is what we call it. And those kids that do transition, they have it. They know what they're doing in the dorms. They know where to go to the dining hall, and it just helps versus the kid who shows up for a week of welcome. They're already 4 weeks behind those other kids sometimes.
Mm-hmm.
And I call them kids, I'm sorry, students.
Ashley?
I want to add to that, if your college doesn't have like a summer transition program, do early move-in. We've had lots of students move in earlier and use that time to kind of navigate campus as well, and figure out where their classes are, where the dining halls are at, and that's really helpful. And I also think just starting the dialogue of mental health supports and normalizing it. It has been great, as Matt said, over the years. I think a lot of students are becoming more comfortable with talking about their mental health challenges, and but just start the dialogue. I've had students that it's taken us like 3 years for them to finally say, "Okay, Ashley, I'm gonna go to therapy." So discuss like their expectations, discuss their fears, just evaluate if they've had like previous therapists before that they didn't get along with, like start that discussion with them. And I think that has been really helpful for us.
Excellent.
Yeah,
Sharon?
I would add to that that the discussion should also include what has been helpful in the past, because sometimes when things are going on along well, we don't realize what we're doing to make things go well. And so really being explicit with the student about what's working, what do you do that helps you, and when things are getting worse, what are things you add back in that help you. And I encourage people to have a written list of that, whether it's on paper or in their phone somewhere. And I do that for our students of all neurotypes. Like, you just need to have your strategies written down, because when we need them, we can forget that we have them. And so reviewing them with the student before they come and having it written down is really helpful.
Great advice.
Yeah,
Amy?
Ashley, I think you touched on this a little bit, but if families are listening, like talking through the expectations that they have of each other, not just that the parents have of the students, but the students have of the parents. And if you're looking at a school that has a support program, having an open conversation about what your expectations are for the program as well. Sharon, I think you mentioned like not having the capacity to support students in their med management. I think some parents potentially think that that's what the support programs are there for, but I don't know of one in the country. Well, there's a few that do a variation of supports, but really that's not the purpose of our programs. So having just a very clear conversation about what the expectations are on all ends, I think is important. And then I also had in my notes a student profile, kind of like that's already been shared, of kind of highlighting what works, what doesn't work, and kind of going from there. One thing our counseling center, I know counseling center professionals aren't listening to this. Maybe they are. I don't know. But one thing that our counseling center at UTC did very well is they had like a Meet Me video that was on their website that you got an opportunity to meet the counselors. And I found a lot of our students who were engaged in our program or just neurodivergent that I worked with, they would go to that and get to know the counselor before they actively went through the process of getting registered. And so that was just a way to kind of take a step back, get to know what you were getting into, and then proceed. So that's always a helpful thing to kind of look for if you're a family that's searching. But if you're a college listening, I think having that on your website's really great.
That's a great tool.
I think the downside of that tool is that the student doesn't usually get to pick the therapist. You know, it's going to be dependent on what the student's need is and the therapist's skills and their schedule. So that, you know, that can be a downside if a student feels like they're shopping for a therapist and then they get told they can't have that particular therapist.
That's true. Some of the support programs like Marshall, though, I mean, several programs have mental health providers within their program too. Or we had like a relationship with one or two that, you know, we had. But yeah, that's important to point out. Once you get your heart set on someone, they might not be available until December and you're looking for August. So that's something important to say.
Yeah, great point. Thanks, Sharon. I wonder if you're all involved with the College Autism Network, and you know that we have a pretty strong research component to our work. And I wonder, have you seen any emerging research areas or innovative programs that show particular promise in supporting autistic students' mental health?
I think just
Sharon?
generally neuroaffirming approaches are, you know, I think in the past, the goal was to help students appear as neurotypical as possible. And now we understand that that is harmful to mental health. And so now the approach is to, you know, identity development as a neurodivergent individual and living into one's identity and learning how to work with one's own brain instead of trying to pretend you have a different brain than you have.
Right. Others? Thing that you've seen looks particularly promising?
Jumping off of what Sharon said, just the continued peer support models. There's been lots of research out there, and a lot of programs are doing kind of, you know, at UT we have share circles that are kind of peer supports, and we also co-facilitate a neurodivergent voices group, which is a drop-in group. So that peer-to-peer support where students are able to hear from each other, that also kind of, you know, reduces any stigma, and I've seen some success with that.
I think that information might be there, and I think programs are doing and putting effort in. I don't represent an institution right now, so I can be honest, right? But I think that's a liability of our programs to say that we promote. We can say we can support, but I think that like promoting that and making that very obvious would be, and I hate to say it, but it's a liability to say, oh, we got you, and then something happened and we didn't. They can come. So like, I just worry that that might be something that families have to like ask when they're visiting campuses. That's kind of not something that you can read about, or maybe you can do your research on, but I really think that that's a question that you ask face to face when you're visiting campuses or when you're making those calls and engaging in information sessions, just because I think that as a director, I would have been hesitant to kind of blast what we were doing, even though we were making strides and doing a lot of work. I don't know as if I would have put it out in certain ways. I don't know if others feel that way, but I'll be honest because I'm not at an institution.
Well, Amy, I'll add to that. I think just being realistic with families and telling them, the reality of it. It's like we have these supports, but I can't guarantee that your kiddo's gonna come to this, and we can't guarantee success. And I think when you have those conversations with parents, a lot of parents that I've worked with respect that honesty and do understand the reality of it. So that's something I would encourage parents when you're talking to these programs. Try and, urge, like, be realistic with kind of their responses as well.
Great advice. Matt, you have something on your mind?
Yeah, why don't we kind of go in that same area? Like I'm coming at this from the parent perspective. So I think it's important to try to, as a parent, let your student do more on their own when they arrive on campus, right? But what would you recommend in terms of how families can kind of check in on the mental health of their student and do that in a productive fashion? And then I think the second part of that would be, is there anything that we should look out for as families that would be true kind of warning signs, if you will, right? That this isn't just that my son or daughter's having a bad day, but there's something more going on that I should, I should potentially reach out to the director of the program with my concern, et cetera. So any perspective you could have of that on, what's an effective way for a parent to kind of keep tabs and check in and support their son and daughter, and then again, are there any things where it's like, if you see this, it would be worth picking up the phone and making a phone call?
Great question. Who'd like to tackle that? You stumped him, Matt. Amy,
I
go
mean,
ahead.
I'm always full of it, right? I have something to say always. No, I would start it by saying, like, I think if that conversation, circling back to one of the points we made at another response, was outlining those expectations and open communication on all ends. I always hated to see a family that would come to visit our campus and then have to feel like they had to hide information about some of the mental health journey that they've gone through to get to a healthy place. And that was always raised more like caution in me as a program lead than if somebody just came and was forthcoming with information. So that like open line of communication, I think, is really key. And that way, program leads, support staff know what to look for, but then also you can hold all parties accountable, right? Parents can bring those conversations up more fluently with their kids, with their students, because they've already had that proactive conversation before they got there.
Great.
I would add, parents usually know their student the best. And so if you're worried, I want to know about it. Because I might be seeing something as just, it's within the range of what I see with transitions, but it might be a very significant setback for your student from where they were before. And so I really want to hear about it. And sometimes when parents call me with a big concern and they just think that their student is really doing horribly, but then I have information, to give back to the parent. Well, yes, they did have a horrible day, and now today they're sitting in the, dining commons eating ice cream with their friends. So, like it can go both ways. The parents may see something that I don't, but also they may be worried because the student called them in a panic and then forgot to tell the parent that everything is okay now. And so I just encourage that communication when the parent is worried. And I always say, it's not. I'm not going to be upset if you call me or email me to express concern about your student, and then I'm going to follow up on it.
Great, thank you.
Sharon, I'm glad you brought that up because I want to go a little bit further on this topic of communication between campus staff and parents. What's allowable? What's not? What's expected? How does that even happen? How do we protect students' privacy, but also keep them safe? Can you talk a little bit about what plans you put in place, what rules and regulations impact parent to staff communication?
That really depends on the school and the program. In my program, students do sign a release for me to be able to talk with their parents. But I also tell the parents I would rather hang out with your kids than with you. And so I'm going to spend my time with them. And if there's a reason for me to reach out, then I will. I tell the students, you've given permission for me to talk to your parents, but I want us to talk about when that's going to happen. And sometimes I'll just say, do you think this is a time when we might want to bring your parents in and let them know what's going on? If a parent asks for information I'm not sure the student wants the parent to have, I'll ask the student, hey, your mom's asking for this information. How do you feel about us talking about it? So the students do sign a broad release that gives me permission, but they're also involved in setting limits on what information is shared one direction or another. To a certain extent. Sometimes a parent has the power and a student just tells me there's no point in trying to set a boundary, just tell her what she wants to know. So I do try to give the student some agency and some say in what's shared. Yeah.
Yeah, I'll add to Sharon. So we encourage our students to sign release of information for parents. I apologize for the freezing. I'm hoping everyone can still hear me. But
Yes.
we encourage, right? And, it's 50-50. Some of our students sign the release so we can speak to parents, some don't. But in our campus, we also have a 72-hour response obligation from our students. So if we don't hear from them, if we reach out within 72 hours, we'll contact the appropriate campus resources. And so that also helps us kind of keep in contact with our students, even if they don't want to communicate. We're like, hey, just send us an emoji. So we know that, hey, everything's okay. And so that has also helped us with our program.
Excellent. Mindy?
I was going to add that, most of us do have I cannot talk today, apparently, informed consent for the program. But if there's a therapist involved, that is a completely different consent. And the information the therapist is going to give a parent is going to be very limited. And there are only going to be some instances where they do provide information, and that's usually danger to self or others and things like that. So I think it's a good time in this panel to talk about the HIPAA restrictions that are going to happen between high school and college, and that the student will have to give consent to parents to know the majority of the information that goes on in treatment for mental health.
And Mindy, how was that received by parents?
Sometimes they understand, and sometimes they don't like that. The therapist that we have, she has her own separate consent, and she does talk a lot about family communication and encouraging an open dialogue with parents. But again, that's student driven. That is because the student is the client in that case. So there are instances where the students will say, I do not want my parents to know what I'm seeking mental health treatment for, and that is their right after they become an adult at the age of 18. I know most of the programs, ours included, would encourage open dialogue and information sharing with parents.
Good. Matt, do you have another question for the group?
Yeah, I do actually. So, I think one thing that can be challenging as a parent sometimes is, what you want for your kid is not necessarily what your child necessarily wants, right? So for example, I think many of us have traditional models of what healthy, happy social interactions look like, for example. how do you all consider that when you are supporting students and working with students and talking with them on a weekly basis? How do you consider the goals of the student and the fact that every individual is a different person and has a different outlook in that regards? And how do you use that in terms of kind of thinking about the mental health and general happiness and well-being of the individual you're working with?
Who would like to start with that? It's a complex question, but
I
Sharon?
feel like I go first every time. That this is a really this is a big one for me because parents usually have such strong ideas about what would look like social success for their students. And we had one parent who he felt like his student didn't have social success unless that student, somebody called him. And I was like, I said, they don't call anybody anymore. That's not a sign of social success. That's not how we use phones now. Or they want to know who their student is eating with. And I tell them our dining commons is the most sensory unfriendly place on campus. And so eating with people is not a sign of social success or not, because most of the time the students just need to get in there, get their food and get out so that they cannot, can avoid the overwhelm. So I really encourage parents to let go of their ideas of what social success is for their student. And I don't start with ideas. I try to get to know the student individually. And if they're telling me I don't need friends, I don't want friends, then I sort of take a motivational interviewing approach to that and find out more about it. Like, hey, what did things look like for you before? Or if I'm seeing signs that they are actually enjoying social interactions in some places, I'll ask about that or point it out. And so it really is different for every student. Some students are happy with one close friend. Some students want to join every club they find. And we really have to work within that student's personality and preferences in defining what is social success for them.
Ashley?
Yeah, adding on to what Sharon said, we start with getting to know the student and having them define what a successful week looks like to them, or even day looks like to them, and letting them lead that conversation. I think, a lot of students prior to them coming to a college campus, they don't know anything about like what is success going to be for them. So we start those conversations early and just get to know them and find out what drives them. And we also look at areas of growth instead of like specific goal settings, because a lot of our students, especially if they've grown up with IEPs and things of that, they have these goals, and sometimes goals may have a negative connotation for some students. So we look at, okay, what areas would you like to grow in this semester? And for some, it's like, I want to go to class 4 days a week. And I'm like, hey, we're gonna focus on that. And so that's where, we try and look at areas of growth.
Truly a great point, Ashley, that students who are maybe coming out of IEPs or have gone through a lot of sort of social thinking training growing up in getting all those good interventions that have made a difference. I think we hear from our program directors that those folks are like, I don't want any more of that. I'm done. I have been through, I have done all of these workshops and all of these strategies, and I just want to be a student now. And so language like goals might be really kind of triggering for them if that's what they've been surrounded by. Again, any questions from the audience, please drop them in the Q&A. I want to go back to a topic early on because I think it's just really critical, and that's the co-occurrence of anxiety. Probably 3/4 easily of students with a diagnosis of autism would also have a diagnosis of an anxiety disorder. And part of that, of course, is the result of just living in a world that's not built for them. That would make anybody anxious. But I wonder if any of you have had some experience with a a student really dealing with anxiety or anxiousness where you've figured out a technique or a strategy, like, okay, this seems to be helpful. Like what are some of the tools in your toolkit for the anxious student? Amy?
I don't know, Mindy and Click too. I'm gonna let Mindy go first.
I was going to talk about, we do a lot of practice with students, reduce fear of unknown. So that seems to be helpful. If a student is worried about going to the library for the first time, we're going to do a buddy system. I think that anytime you can role play practice any situation, that's going to be helpful.
Right. Amy?
I mean, I think we feed off each other's energies, right? And that's no different from staff to student, student to student, student to parent. And so I think one of the first things that we do is when a student is coming for retreat, we would separate the parents and the students to get a true gauge. And I love parents. I'm a parent. But sometimes just that separation of existing in a space and building the confidence that they can reduce some of the anxiety. And so if our staff was very healthy, it played well with the students, right? And if the students were feeling like they belonged in a good space, it played well with the staff. And then all around, it's that like everybody kind of checking in on themselves. And I know that's easier said than done, but making sure that like increased anxiety isn't because a roommate's super anxious and they're feeling the weight of that, or making sure that we as parents aren't pushing in a way that's causing an increasing anxiety. So eliminating those external factors before we start addressing some of those internal pieces, I think is key. And I love parents. I'm a huge supporter and collaboration, but sometimes just separation is good. They grow a lot.
Yeah, I mean, I will just chime in and say I agree with that, Amy. I mean, I think like any parent of any student going to college, you have anxiety to some degree as a parent about how's everything going to work out, and we saw tremendous growth from our son over the course of the year, and he had a great year. So those success stories really are out there, I will say, and it's we think him going away, he got a lot of growth that he would not have had he been in our house for one more year. So there is an upside to it for sure.
I would like to
Ashley?
piggyback.
Sure.
Oh, go ahead.
No, go ahead, Sharon. You unmuted first. So go ahead.
Okay, I was just going to piggyback on what Ashley or what Amy was saying about, we affect each other. When I do training with CSP staff and with faculty and staff on campus, one of the first things I always teach is that it's your job to share your calm, not join the chaos. And you have to regulate your own nervous system. And I teach strategies for regulating your nervous system. My first specialty before autism was trauma. And so I'm always focused on nervous system regulation. I teach students very early about window of tolerance. I teach them some occupational therapy based physiological self-regulation strategies the very first day that they're on campus. So we do a lot of focus on regulation. If I feel like the room's getting dysregulated, I'll guide us all through some sort of regulating activity together. I've done it with professors when I'm doing faculty trainings too. I'm like, oh, there's too much dysregulation in here. Let's all breathe together or something. And so, yeah, I think Amy hit the nail on the head with that. Like it's really helping everybody in the system to regulate.
Right.
And piggybacking, modeling it too with the student, we do a lot of that, of what that looks like, of what regulating yourself in the moment does look like, and making sure we are calm as well. And, helping students, Matt, you mentioned this a while ago, like expectations parents have. A lot of times students put expectations on themselves, and really understanding and kind of, going through what those expectations are with their student to help us as a provider understand where that anxiety may be coming from and helping the student navigate those expectations.
Yeah,
Great.
sorry, Lee, how often did we get the student who walked in and thought the world was over because they got a B? And like we had to spend time asking the questions, de-escalate, kind of process through to then understand, oh, a B, like, but that was a very real experience for that student, but that heightened level of anxiety. So kind of teaching them how to navigate the newness that's around and their own like internal expectations too. I did also want to say, I don't want to discredit that some people come in and the transition is impactful. So it's not just maybe like feeding off of other people's energy, kind of like the direction we took the question. I'm sorry to derail us, guys, but it's also like being in tune with themselves and knowing that sometimes there are additional supports that are needed. And that goes back to the question of like, how do we know when our student or son or daughter is struggling? That can be kind of being in tune with your student and kind of knowing and knowing when to seek out other supports. So I don't want to discredit that. Some people really are impacted for acute periods, right? Transition is heavy once you get back into your routine. And so maybe it's temporarily using new medication, or whether it's kind of seeking out external services from the campus, or seeking out the counselor on campus, I think can also be a strategy.
Thank you all. As we get close to the top of the hour, I'm going to come back to each of you and just ask you for one quick piece of advice that you would like to share with parents as they consider the option of college for their student. But I'll give you a moment to think about that while I just mention a few other things. My colleague Brittany will put some stuff in the chat for those in attendance. Inclusive Academia is the YouTube channel that Matt mentioned. Super helpful for just really exploring a lot of different colleges programs. On the College Autism Network website, we have a lot of resources under our resource tab that for families and rising students. I especially want to note College for All, which is a website designed by a high school student, an autistic high school student who wanted to create a useful resource for students like her who don't seem to get the kind of understanding and that they need from their high school counselors. And so I asked her, like, could you create something in your voice? And College for All is really a terrific resource. And Matt, anything else that we wanted to pitch?
Well, I would just say that we're currently conducting a survey through the rest of this month on the topic effectively parenting your college neurodivergent student. And so we're trying to gather perspective both from folks like the ladies on the call today, as well as from parents and from students and recent students as well. So we can send the link out to that survey after the fact. We would love to hear from you all and your perspectives, and hopefully build a resource that'll be available to families.
All right, thanks, Matt. So one really hot tip. Who'd like to start?
I'll start before my internet is not friendly with me anymore. Students during, as they're transitioning to college, they're in the process of discovering who they are, discovering one's own agency. So my biggest tip was figure out how to continue to empower your student throughout this phase. And then communication, just establishing great communication and be willing to really hear them out. That's going to be one of my biggest tips.
Thanks, Ashley. Sharon?
My biggest tip is to expect growth and to not get too specific about what you expect that growth to look like.
Excellent. Mindy?
I would say have conversations before the student gets to college about your expectations, how often you want to hear from the student, those kinds of things, because once they're at college and really focusing on their new role as a student and becoming an individual, sometimes it's just not on their mind to phone home. So don't take offense when they don't, but set that expectations up early.
Great. Thanks. Amy?
Mine is don't prevent a fail or a struggle, because I think a lot can be learned in those zones. And so I think that while they're in college, while they're potentially in the space of college support programs, or while they're surrounded by the college community, it's not our role to prevent the fall or the struggle, but to help them navigate and dig them way out. That builds resilience, that builds confidence, and that is employability. That helps them in the next transition. So it's not just about their 4 or 5 years with us in the college space. It's about life beyond, and that can be learned in times of struggle. So that's my advice.
Wonderful. Well, heard it here first. Pro tips from the pros. I hope that's been helpful. I hope this webinar has been helpful for all of you in the audience and those of you who view it as a recording later. I want to thank our panelists, Ashley, Sharon, Mindy, and Amy, for being here and sharing their amazing wisdom. I knew they'd come through. I want to thank Matt, my co-host, and Brittany, our back of the house technical person who's been running the webinar. For those of you who are signed up for our series, we'll see you next on July 10th. We'll be in the thick of summer at that point, but we hope that you'll be able to join us then for our next topic, which is career planning and supports, and what you can expect from college staff in that regard. So thank you all very much for being here, and we'll be sending out an evaluation and some other links for you to take a look at. You'll get those along with the link to this recording in the next day or two, I think, right? Okay. Thanks everybody, and good night.